When we are examining the patient, particularly the upper and lower eyelids, we carefully assess the position of the fat pads. We must evaluate their location and prominence very accurately. Generally, when performing this examination, whether it is the lower or upper eyelid, once we close our eyes and apply a very gentle pressure, we are able to clearly see the locations of the fat pads in the upper or lower eyelids. We see them very clearly, and particularly regarding the position where they are located, we are able to evaluate their herniation and bagging in a clear way. Basically, the logic and philosophy of lower and upper eyelid aesthetics are very different from each other. Upper eyelid aesthetics is a surgery that can even be performed under local anesthesia if we are only doing the upper eyelid. And during the planning, when we open and close our eyes on our upper eyelid, if we make a plan to place the suture line inside the fold that forms, no one can find or see the scar of this surgery. On our upper eyelid, particularly the ones that are situated on the inner part, we remove only the required amount from the body from the fat pads located in the middle and on the outer side. And we remove the excess skin tissue along with a small amount of muscle tissue, and the incision that appears on our eyelid is closed with aesthetic, dissolvable hidden stitches. And we conclude our surgery with tapes, which we call strips, that we apply to our suture line in the surgical area. Sure, it is very beneficial for the patient to apply cold ice application at home after the surgery, ultimately to minimize the trauma in that area. And the patient recovers fully within an average of 3 to 4 days and returns to their work and social life quite comfortably. In some cases, we only perform lower eyelid aesthetic surgery, or we perform lower and upper eyelid aesthetic surgery combined together. My basic philosophy in lower eyelid aesthetics is based on not removing the fat pads, not removing them from the body. Particularly in the lower eyelid, by reorganizing the locations of the fat pads, we must ensure the fullness of the lower eyelid, smoothness and evenness. And even if we are performing it in combination with the upper eyelid, I prefer to use the fat tissues we removed from our upper eyelid in our lower eyelid to place them in the areas where they should be, where they are lacking. I prefer. Because if we remove the fat pads in the lower eyelid unnecessarily, the hollowness that will form in this region makes the patient look tired, aged, and a little bit weary. Therefore, in order to resolve this issue and ensure the lower eyelid is smooth, we will preserve the fat pads in the lower eyelid. In lower eyelid aesthetics, we place our incision exactly 1 to 2 millimeters below our eyelashes. Therefore, the patient will not have any problems with any scars in lower eyelid aesthetics. The surgery time for the lower eyelid is on average 1 hour and 15 minutes to 1.5 hours. And following the surgery, we apply a bandage that looks like a butterfly wing using adhesive tapes, and this bandage remains for about 3 days. 3 days later, once we remove the bandage, our patient is able to return to their social and professional life. In any case, we must perform cold applications or cold compresses on the lower eyelid, just as we do for the upper eyelid. And in these operations, I honestly like and recommend to my patients to create a look by taking the lower eyelid slightly upwards. I honestly enjoy and recommend to my patients to create a look that we call slanted eyes or almond eyes in a very pleasant way. In these patients, if the junction points of the lower and upper eyelids where our eyelashes meet are slightly tilted upwards. Because it gives a more intelligent, more lively, more vigorous expression, I always try to create this expression, and we are always happy with the result.